Hello, I am Dr. Eric J. Bailey. This is my paper presentation for the Society for Applied Anthropology 2024 meetings in Santa Fe, New Mexico. The title of my paper is Using Applied Anthropology to Investigate Myths and Misconceptions, along with the mental and physical impact associated with COVID-19 among Gen Z college students. Here's my introduction. Since COVID-19 disease continues to be a significant public health and medical condition among all segments of the U.S. population and globally for the past 5 years, it is vital for public health researchers and clinicians to renew our investigation of this deadly disease, which continues to hospitalize thousands of individuals each month. In December 2022, according to the Center for Disease Control and Prevention, adults 18 years and older who received an updated COVID-19 booster vaccination dose was 2.6 times less likely to be hospitalized for COVID-19 compared to unvaccinated persons who were 16 times more likely to be hospitalized for COVID-19. Even after 5 years of the world experiencing this pandemic, public health and medical officials still encourage the general public to not only get their vaccination shots for COVID-19, but also get their yearly booster shots for this once very deadly respiratory disease. In 2021, I conducted a pilot study among 51 East Carolina University college students on their disease perception and adaptive behavior associated with COVID-19 and found that this Gen Z college student population were not only worried about the spread of COVID-19 on campus, but also struggled in their mental health adjustments and being diagnosed with COVID-19. Quantitative data, as well as qualitative data, personal comments, strengthen the major findings from this pilot study. To dig deeper into my initial findings from the 2021 pilot study, I conducted a larger mixed method study among the ECU student population focused on the following three specific aims. 1. Investigate myths and misconceptions associated with COVID-19 vaccines. 2. Determine the degree to which mental and physical symptoms associated with COVID-19 influence rates of updated booster. And 3. Develop new strategies to prevent misinformation about vaccines and COVID-19. By doing this research, we hope to not only develop new culturally specific strategies for our East Carolina University Gen Z college student population to prevent misinformation about vaccines and COVID-19, but also to motivate public health and clinicians to dig deeper into the biopsychosocial cultural factors associated with this deadly disease, which has significantly affected the mental and physical well-being of Gen Z college students in North Carolina and globally. So the research study on April 25th, 2023, our ECU vaccination study, phase 2 was officially approved and received exempt certification status from ECU University and Medical Center Institution Review Board to conduct our research study on the ECU student population. The research team consisted of myself, Dr. Peter Francia, Director of the Center for Survey Research in the Thomas Harrod College of Arts and Sciences, and Kalea Kruger, a second-year honor student in ECU Honors College. This phase 2 of our ECU vaccination study utilizes services of Thomas Harrod College Arts and Sciences for survey research, which helped to distribute our ECU vaccination assessment tool. Number 2, to 2,000 East Carolina University students from October 2023 to January 2024. Our Qualtrics designed ECU vaccination assessment tool collected quantitative and qualitative data on students' perceptions and vaccinations and COVID-19, their physical symptoms and mental health status as it relates to COVID-19, and their culturally specific strategies and suggestions on how to improve vaccination rates among ECU college students. The 2,000 ECU students received the invitation to participate in our online Qualtrics design research study via email. Those students who decided to participate in our research study had to complete the informed consent statement at the beginning of the Qualtrics survey. The amount of time to complete the online Qualtrics survey was 10 to 15 minutes, and there was no incentive to complete the survey. In the informed consent statement, students were also informed that there was a possibility that they would be randomly selected to participate in a small focus group, which would be a part of the next phase of the research study. Here's the research findings. The total response from the email invitation sent to 2,000 ECU students from October 2023 to January 2024 was 117 students, covering all designated years of college, from freshmen, sophomores, juniors, seniors, and graduates. Of the 117 responses, 70 students completed the entire Qualtrics survey. Thus, a total of 3.5% of the sampled 2,000 ECU student population completed the ECU vaccinations assessment tool number 2. The three major categories from the ECU vaccination assessment tool in which data were collected for this research study involved: 1. Vaccination, the students' beliefs affiliated with COVID-19 and vaccines; 2. Physical and mental health status, how COVID-19 affected students' physical and mental well-being; and 3. Social demographics, the gender, health, height, weight, year in school, full-time, part-time student, ethnicity, race, international student, current relationship, place of residence, household income, health insurance, and political affiliation. The entire data set, the quantitative and qualitative data, was analyzed using SPSS 28.1 quantitative software and Atlas TI 24 qualitative software. Using these quantitative and qualitative software packages to analyze and critique our data set allowed us to establish a more well-rounded and deeper understanding of the significant vaccination and COVID-19 issues related to our sample ECU student population. Here are the quantitative findings. The first set of descriptive quantitative findings from the Qualtrics survey involved the basic social demographics of our sample ECU student population. Consists of 70. Our sample ECU student population can be described as follows: 72% female, 22% male, 1% transgender, 1% non-binary, non-conforming, 4% prefer not to respond. 69% white, 17% Black or African American, 7% Hispanic, Latino, Latinx, or Spanish origin, 6% Asian, and 1% American Indian or Alaska Native. 26% of our sample were sophomores, 23% graduate students, 21% seniors, 16% freshmen, and 14% juniors. 58% lived in off-campus housing, 26% lived in campus housing, 9% lived in other, and 7% lived with parents or guardian. 94% have some kind of health insurance, and 6% do not have health insurance. 26% are politically independent or leaning independent, 24% Democrat or leaning Democrat, 23% Republican or leaning Republican, 21% non-political affiliation, and 6% prefer not to answer. The major quantitative findings from the Qualtrics survey of our sample ECU student population concerning some of the major myths and misconceptions globally associated with COVID-19 vaccines and vaccines in general were as follows. Number one, 70% strongly disagreed with the statement, quote, "Do you believe that COVID-19 enters your cells and alters your DNA?" That's 70%. Strongly disagreed. Number two, 86% strongly disagreed with the statement, quote, "Do you believe that there may be tracking devices or some sort of microchip in the COVID-19 vaccines?" That's 86%. Number three, 46% strongly disagreed with the statement, quote, "Do you believe that it is not necessary to receive COVID-19 booster in order to stay protected from COVID-19? That's 46%. Number four, 31% strongly agreed with the statement, quote, Do you believe that it is not safe for people with existing health conditions to receive COVID-19 vaccine? That's 31% strongly agreed with that statement. Number five, 31% strongly agreed with the statement, quote, do you believe that COVID-19 vaccines do not work because one can still get COVID-19 after vaccination? That's 31%. Number six, 44% strongly agreed with the statement, quote, the current vaccines for COVID-19, Pfizer, Moderna, Johnson & Johnson, are highly effective for reducing my chances of getting COVID-19. And seven, 67% stated that they did not receive vaccination against COVID-19 in the last 12 months. That's one shot or two shots. That's 67% stated that they did not receive a vaccine against COVID. The major quantitative findings from the Qualtrics survey of our sampled ECU student population concerning how COVID-19 affected students' physical and mental health status were as follows. I apologize. Number one, a score of 7 on a scale from 1 to 10 on how would you rate the severity of your symptoms was given by a higher percentage of students, 23%, than any other group. Number two, a score of 5 on a scale from 1 to 10 on how you felt your family member and or group handled being diagnosed with COVID-19 physically, mentally, or emotionally was given by a higher percentage of students, 20%, than any other group. 55% stated that, quote, somewhat difficult to the question, how difficult have mental health issues made it for you to do your work, taking care of things at home, or get along with other people? That's 55%. Number four, 75% describe their overall health today as very good to good. The qualitative findings. Again, that was the general quantitative findings. What about the qualitative findings? The major qualitative comments from ECU students concerning how to get more ECU students vaccinated for COVID-19 were as follows. Quote, now here's the qualitative responses. Quote, I would recruit a person who has COVID-19 with active symptoms into allowing me to film and document their experience. Then using that material, I would get approval from that individual to show other students what kind of experience can arise from a COVID-19 infection and show how vaccination can help either prevent or similar occurrence or dramatically reduce the chances of getting it, unquote. Another comment. Make it more public and available. Less information, more sharing of knowledge. The next quote. Incentivize them with free entry to local bars or gift cards to local businesses. Another quote. I would focus on vaccination, understanding what the vaccine done biologically, and promote the fact that even though the vaccine does not stop you from contracting the virus, it can assist in fighting it off and why this is. Another quote, easy access and advertise and encourage it around campus. Another comment, like donation trucks, offering an easy and convenient way to get vaccinated on campus would immediately up the number of students receiving the vaccine, offering incentives, i.e. free food. Another quote, I would accomplish this by explaining the risk of not getting the vaccinations, including the long-term harm of viruses can do to the body. Another quote, showing the dangers of not getting it, even though it doesn't entirely, it can help lessen symptoms and prevent points of death. Another quote, I would offer them pizza and free t-shirts. Another quote, find a way to meet them where they're at when it comes to possible vaccine hesitancy. I know some people are very stuck in their ways and won't budge when it comes to things like this, but I feel like forcing them would only make the situation worse. Another quote, sending out information about the vaccine, debunking myths about vaccines, and making it readily available for those who want the vaccine. Another quote, Provide some sort of incentive and education on benefits of receiving a vaccination. I believe that the majority of students would do something if it provides them with personal gain for minimum effort. Since most college students are at low risk from being severely impacted by COVID 19, the main benefit to being vaccinated as a healthy college student is to protect others who cannot get the vaccine for certain reasons or who are uh, immunocompromised and would suffer greatly from an infection. If you can tie in the morality of, of vaccinations with a personal incentive, I think the majority of college students would get vaccinated. Another quote, and this is a little bit longer. To increase student vaccination rates at college, I would implement a comprehensive program with the following steps: education and awareness campaign, launch an information campaign using various media highlighting the importance of vaccination and its benefits, share accurate information addressing common concerns and myths about vaccines, convenient on-campus clinics, set up vaccination clinics on campus to make it easy for students to get vaccinated without leaving school, ensure flexible hours to accommodate various class schedules, incentives, offer incentives like gift cards, discounts, or other rewards for students who get vaccinated, hold raffles for attractive prizes to encourage participation, peer influencers, collaborate with student organizations, athletes, and influencers to promote vaccinations within their peer groups, mobile app and online scheduling, create user-friendly app or website for scheduling vaccine appointments, send reminders and notifications for appointments, vaccine information sessions, host informational sessions or webinars led by healthcare professionals, allow students to ask questions and express concerns. Cool. Another quote. Here's the final quote. The final quote. I would encourage. I would create a fun event like Flu Fest. This event held by ECU Health that encourages students to get their flu shots. If possible, I would provide a raffle that every student who is vaccinated is entered into. Unquote. Using the qualitative software Atlas 24 to conduct the qualitative analysis, the major concepts and words used by our sample ECU students using cloud and list and tree map analysis were as follows. 1. Vaccine. 2. Information. 3. Incentives. 4. Easy. And 5. Myths. Those were the major themes coming from our qualitative analysis. 1. Vaccine. 2. Information. 3. Incentives. 4. Easy. And 5. Myths. With these further qualitative analysis, in digging deeper into major concepts and words used by our sample ECU students' statements in describing their concerns on how to improve vaccination rates, we have a much better understanding of the major factors that would likely influence students to get vaccinated for COVID-19 and other infectious disease. Here's my reflective comments. To dig deeper into my initial findings from the 2021 ECU vaccination pilot study, my research team and I conducted a larger mixed method study among the ECU student population. After distributing our survey to 2,000 ECU students, we received a response rate of 3.5% for a total of 70 completed surveys. The 3 specific aims of our study were as follows. 1. Investigate myths and misconceptions associated with COVID-19 vaccines. 2. Determine the degree to which mental and physical symptoms associated with COVID-19 influences rates of updated booster. And 3. Develop new strategies to prevent misinformation about vaccines and COVID-19. By doing this research study, our findings uncovered quantitatively and qualitatively that our student sample disagreed with the major mainstream myths and misconceptions associated with COVID-19, experienced higher levels of mental and physical stress associated with COVID-19 than anticipated, and provided new culturally specific public health and medical outreach strategies to reduce vaccine hesitancy thereby improving vaccine rates for not only COVID-19, but also for all other types of vaccine initiatives for the ECU college student population. With that said, I am Dr. Eric Bailey. That's my paper for the Society for Applied Anthropology 2024 meetings. Again, the title of my paper, Using Applied Anthropology to Investigate Myths and Misconceptions, along with the mental and physical impact associated with COVID-19 among Gen Z college students. Thank you for your time. Have a great day.